Communities across the United States face a wide range of emergencies, from public health crises to natural disasters and large-scale incidents. The ability to respond effectively often depends on preparation that takes place long before any event occurs. Local emergency response systems play a central role in shaping how communities plan, train, and coordinate across agencies. As response environments grow more complex, preparedness has become a continuous process rather than a one-time effort. Current emergency management requires coordinated efforts of emergency medical service, public health departments, local government agencies, and community organizations. All of these entities should work together in a clear manner with shared responsibility and good communication. How well these elements are aligned prior to an emergency will often dictate the success of the response. Emergency preparedness has become more important as communities experience a wider range of risks. Severe weather events, public health threats, and infrastructure challenges have increased the demand for organized and flexible response systems. Population growth in urban and suburban areas has added pressure on existing resources, requiring local agencies to adapt their planning strategies. Preparedness is not limited to large-scale disasters. Everyday incidents, such as traffic accidents or localized health outbreaks, require coordinated action from multiple agencies. These events highlight the need for consistent training and shared protocols. Communities that invest in preparedness are better equipped to respond quickly and reduce the impact of emergencies on residents. Public awareness has also shifted in recent years. Residents expect local governments to provide clear guidance before, during, and after emergencies. This expectation has led to an increased focus on transparency and communication. Preparedness programs now often include public education campaigns that encourage individuals and families to take an active role in their own safety. The complexity of emergency response systems today exceeds what we have experienced over prior decades. Modern technology has allowed greater efficiency in both communication and data exchange. However, new forms of coordination and data management complexities were created with the introduction of these new systems. Therefore, other factors now require that public safety-driven organizations process high volumes of data in real time and are responsible for many decisions affecting their communities. Another factor contributing to complexity is the interconnected nature of modern communities. Transportation systems, healthcare networks, and communication infrastructure are closely linked. A disruption in one area can quickly affect others. Emergency planning must account for these connections to ensure that response efforts remain effective. Workforce considerations also play a role. Many communities face staffing shortages in emergency services, which can impact response times and operational capacity. Training and retention have become critical priorities for local agencies. Preparedness strategies must address not only equipment and systems, but also the people who operate them. Preparedness begins at the local level with structured planning and regular evaluation. One of the most effective tools used by communities is the implementation of training exercises. These exercises simulate real-world scenarios and allow agencies to test their response capabilities. Participants can identify gaps in communication, resource allocation, and decision-making. Unified command structures for training exercises determine how different agencies will collaborate with one another and gain a level of trust that leads to a common operating environment in emergencies. Agencies leverage this opportunity to understand their specific roles when a response is required during an emergency event. Agencies conduct after-action reviews to analyze performance and to establish areas for change in order to improve future response capabilities. Public education programs are another key component of preparedness. Local governments and public health agencies provide information on emergency kits, evacuation plans, and safety procedures. These programs aim to empower residents with knowledge that can reduce risk during an incident. Schools, community centers, and local organizations often serve as platforms for delivering this information. Preparedness efforts are also supported through a network of volunteers who help provide response to public safety incidents. Residents of communities who receive basic training will be able to support professional responders during emergencies by assisting in areas such as shelter operations, supply distribution, or communication efforts. Residents' participation in preparedness activities helps build a wider support system for a community while supporting its resilience. Effective emergency response depends on strong coordination between multiple agencies. Emergency medical services, fire departments, law enforcement, and public health organizations must work together under a unified framework. This coordination ensures that resources are used efficiently and that decisions are made with a clear understanding of the situation. Unified communication systems are essential to this process. Agencies rely on shared platforms to exchange information quickly and accurately. These systems help prevent misunderstandings and allow responders to adapt to changing conditions. Consistent communication protocols also support collaboration across jurisdictions, which is especially important during large-scale incidents. Interagency coordination extends beyond response activities. Planning and policy development often involve collaboration between local governments and regional partners. By working together, agencies can align their strategies and create a more cohesive approach to preparedness. This alignment reduces duplication of efforts and improves overall effectiveness. Private sector entities often partner with emergency services in terms of coordinating their response efforts, e.g., when hospitals coordinate with utility companies and transportation agencies. These types of organizations are important to the overall success of an effective response to any emergency, as they can help agencies maintain the continued delivery of essential services during an emergency scenario by being involved in planning operations ahead of time. Experienced professionals play a significant role in shaping community preparedness efforts. Individuals who have worked across emergency medical services, public health, and government agencies bring valuable insight into the planning process. Their experience allows them to identify potential challenges and develop practical solutions. Emergency response professionals in Colorado, including Scott Bookman, have emphasized that effective preparedness begins well before an emergency occurs. This perspective reflects the importance of coordination between agencies and the need for continuous improvement in planning efforts. Leaders with diverse backgrounds can bridge gaps between organizations and support more integrated response systems. The role of leadership extends beyond decision-making during an incident. It includes building relationships, fostering collaboration, and maintaining a focus on long-term preparedness. Leaders must balance operational demands with strategic planning to ensure that systems remain adaptable and effective. The professional background outlined in the provided materials highlights the importance of experience across multiple sectors. For example, leadership roles in emergency medical services, hospital administration, and public health provide a comprehensive understanding of how different systems interact. This type of experience supports more informed planning and strengthens the overall response framework. The future of emergency preparedness will likely involve greater integration of technology and data-driven decision-making. Advances in communication systems and data analytics can improve situational awareness and support faster response times. However, these tools must be implemented carefully to ensure that they enhance rather than complicate operations. Public-private partnerships are expected to play an increasingly important role. Collaboration between government agencies and private organizations can provide additional resources and expertise. These partnerships can also support the development of new strategies for addressing emerging challenges. Training models will continue to evolve as well. Communities are exploring new approaches that combine traditional exercises with digital simulations and scenario-based learning. These methods allow responders to practice a wider range of situations and improve their ability to adapt to unexpected conditions. Another priority for us is developing engaged communities. Knowledgeable and engaged residents are key to effectiveness in preparedness initiatives. Future programming will also put a greater emphasis on outreach and education that will help make sure individuals know their role during emergency situations. Scott Bookman, Colorado, has also been referenced in discussions about the importance of coordinated systems that connect public health, emergency services, and local leadership. This approach reflects a broader trend toward integrated planning that considers the needs of the entire community. Community preparedness is an ongoing process that requires commitment from multiple stakeholders. Local governments, emergency services, public health agencies, and residents all play a role in creating effective response systems. By focusing on coordination, training, and communication, communities can improve their ability to respond to emergencies of all types. Preparedness is not a static goal. It evolves as new challenges emerge and as communities grow and change. Continuous evaluation and adaptation are essential to maintaining strong systems. The integration of experience, technology, and collaboration will shape the future of emergency response and help communities navigate an increasingly complex environment. The emphasis on coordinated planning and shared responsibility illustrates how essential it is to work together as one across various sectors. The confidence that communities are creating through preparedness efforts now will help form an enduring support system for both immediate response needs and longer-term ongoing resilience of the community.